And action! Hey everyone, it's Dr. Rick. Deb had a question about earwax. Earwax is not a life-threatening thing, but it does become a nuisance for some people. Earwax, the official name is cerumen, is supposed to be a good thing because just like the scalp and the face and the body, the integument or the skin is very important and to upkeep, or at least to take care of. And part of the process of the skin taking care of itself is it will secrete oils. Oils, when solidified, will turn into wax. And if there's not enough oil, your skin becomes dry, it'll become cracked, and there'll be a penetration through the cracks of bacteria or other trauma, or they'll be able to leak fluid out, and that's not good either. So if this is the first time you're finding me, don't forget to hit the subscribe button down below if you like this video, and the alert button to find out when I do new videos. So earwax. Here is a picture of an ear. So this is the right side of the head. Here's the ear. This is the canal where the sound waves come down and hit this blue thing called the tympanic membrane. So right here are the things you're not supposed to put in your ear. And this is a Q-tip. I mean, it's fine to get the water out with the Q-tip. And I think we all try to scratch the inside of the ear because it feels good. And then there's a finger over here, which is fine, again, for relief, I guess. But you have to be careful with the nail because if you scratch too hard, you'll puncture or break the barrier. And again, barrier is supposed to be impervious. When there's a break in it, you can allow bacteria in. Not a good thing. I just remembered when I was a kid, I used to use a hairpin. That's a hairpin. I used to take my mom's hairpin and stick it down my ear and try to just scratch my ear. Not good, because now that I think about it, it's kind of gross. I don't know where the hairpin was, probably on the floor, or could have been used for who knows what. But felt good. I didn't know anything back then. So again, so if you look at the ear and the canal where you're not supposed to put your finger down, this is, if you look at my video, which I'll put my other videos on how the ear works. This is the middle ear. This is the eustachian tube, and this is the nose or sinus passage. So this is the hearing organ, cochlea, and these are the semicircular canals for balance. I have two videos. I'll put them down on the links below. But these things, I'm going to come closer because you might not see it, but the tympanic membrane is a very, very thin membrane that's supposed to move like a tom-tom drum skin. And when sound waves come through, it vibrates the tympanic membrane, and the membrane is connected to three tiny bones, super tiny. In fact, they're the smallest bones in the body. And the three bones vibrate, and they also in turn stimulate sound waves through mechanics of movement into this cochlea. And this is kind of like a snail's house. And when that vibration translates to the three tiny bones, and the three tiny bones move this little window, it sends vibrations through the waves of fluid inside this cochlea, and you, through stimulation of these little hairs, send impulses to the brain, and that's how you interpret sound. You can also have painful sound, which is not good because impact sound, like a gunshot, will actually vibrate this thing violently. And when it vibrates this delicate membrane violently, it'll vibrate the three bones violently, and it'll potentially destroy either the bones or perforate the eardrum or cause too much damage, at which point you don't hear anything. It gets interpreted as pain. And you don't hear anything because the organ, the ear and the cochlea and the three little bones and the three little tiny muscles that controls those bones, they all go into shock and they stop working. And that's why in movies, when you see a flashbang or a explosion, sometimes new directors will pause the sound because they want you to feel like the actor felt, and you don't hear anything for a while. Really cool special effect in the movies, but it does happen. And speaking on those terms, when you do have excessive amounts of force, like a cup to the ear in martial arts, or a gunshot or an explosion or a flashbang, that'll cause damage. So, and likewise, if you put anything down here hard enough, you'll puncture the eardrum and you'll again cause damage. It'll cause pain. It'll cause difficulty with hearing. And that's why you're supposed to be very careful when you put things down the external auditory canal. So, what happens with earwax? And why am I talking about all this trauma? Well, earwax, again, is normal, but it can accumulate. And this is the typical accumulation towards the outside of the external auditory canal. And when you have a little bit of accumulation, if you liquefy it properly, it's supposed to actually leak out without noticing. It's supposed to leak out and in a shower clear itself. But for some folks who don't stay hydrated enough or produce a lot of wax, say you're going through hormone problems, testosterone is starting to ramp up, or your estrogen, if you're a woman, is starting to change, or you are on a certain medication, or you're eating too much bad, not healthy food, but not so bad food. If you're eating like you're not supposed to be eating, then sometimes the oil will change. And if it changes, it becomes hard. If it becomes hard, it'll cake up. So what are you supposed to do with that? Well, sometimes what we can do, if it's mild, is we can actually use equipment like this. This is, hopefully you can see it, this is what we use to scoop out the ear wax. So, this thing, depending on the size of the individual, and usually it's for kids, we kind of put this in there with an otoscope. It's like a magnifying glass, and we check to see where and how far deep we can go as far as pulling some wax out. You'll have pain if we go all the way in and start to scrape on the tympanic membrane, which most of us are usually very good at kind of stopping when we get close to the tympanic membrane. But we have to sometimes pick out some of the soft stuff that's just too hard to get out. Or we can just clean it and usually do no damage because they're made of plastic. I used to use a metal one, which is very, very soft, but it was just enough, and but the problem is everybody worries about infections, so now we have these disposable ones. I like the metal ones better. I think they're stronger and they're less painful than these things. You can see there's a little point toward the end, and the metal ones were looped and had a round edge. So that's one way to take care of wax. And there's different sizes. If you go to an ENT or otolaryngologist, he can actually, with the appropriate amount of suction, he can use a little machine that sucks out the wax if it's soft enough. If it's not soft enough, you can actually use fine instruments and pull wax out or pull foreign bodies out. I remember in the Philippines, I used to pull out cockroaches, depending on where we were doing the volunteer work at, or wax or debris. But it sounds kind of gross, but people put things in there. There was one kid that I remember put a pea in the ear, and we had to, it was hard to get it was hard to get the loop around the pea, so what we did was put a drop of crazy glue at the end and stuck it to the pea and then pulled the pea out, which was kind of cool, but dangerous. If the crazy glue and the end of the loop got stuck to the skin, you'd be having some problem. So if the wax is soft enough, then it comes out real easy. Sometimes you don't even need to use a loop. Sometimes all we do is use this. So this is peroxide, usually used to soften, and sometimes bubble up. And when you bubble up or you squirt fluid, now this is usually just saline or peroxide, and this is just a typical 60 cc syringe with a soft or a soft nozzle. If you put this into the external auditory canal with fluid in it, you can put this in here and then squirt some fluid into the ear, and usually it squirts in and pushes around and pushes the wax out. So even if the wax is almost completely obstructed like this one, this piece of wax is blocking. But if you can get the projection of the nozzle into the right spot, whether we chip away a little bit with the loop or you can see a spot that's there, you can kind of force fluid in this way and it'll go around and push. Problem is, this can cause pain too, so it has to be done gently and probably multiple times. Usually what we'll do here is we'll put this at the edge, we'll squirt down, you'll probably be wet a bit, but a couple of, usually 2 or 3 times will jettison a lot of the loose wax out. And if it's hard wax because you're not drinking enough fluid, or you're not balanced as far as how liquefied the oil is, well, at least if you put some peroxide and some water into the external auditory canal, the wax, if it's soaked enough, will accept some of the fluid and it'll start to soften over the course of time. And sometimes if we can't get any wax out, or it's just too solid, we'll have you on your side. Usually it's like this. You drop in some ear drops called Debrox. You can get that over the counter. And Debrox, when you drop in a few drops, it fills it up like a glass of water, and if you stay in that position, or you put a piece of cotton around the edge or the hole of the external auditory canal, the wax will start to soak in the Debrox, which is essentially oil, and the wax will soften. So that over the course of a couple more days, it'll usually come out on its own, just by manipulation of the ear. Again, the idea is that when you use a Q-tip, you can see the size of the Q-tip, and you can see the size of the external auditory canal. Sometimes you won't be able to, if you get the Q-tip in and it's just grazing the edges, you might be able to turn the Q-tip and kind of have it attract the wax if it's just lining the canal, and pull out the wax that way. But if it's blocking it, all you're going to do with this thing is blunt force. You're going to push it in deeper. And that's what happens with this one. So when the wax gets to coat like this, it's kind of caught like a meniscus. It coats the eardrum. It's very hard to get that out because you can't touch that without hurting the eardrum or causing pain. So that's when you have to do as much as possible, be patient, and you're not gonna be able to hear anything with this one or this one. So if you just soften this wax up enough, it should leak out on its own when you turn to gravity, like when you're sleeping at night. If it's dripping out slowly and you liquefy successfully all the hard wax, it'll drip out when you keep that ear to gravity. And most ears will, usually with yawning or with pulling the ear lobe, will pull through a suction, will pull the wax out a little bit at a time. So, and you'll know when you're pushing too hard, or if you're blocked up like this, completely blocked up. What will happen is that this eardrum is supposed, not only will you not hear, you'll also have pain. It'll feel very full every time you blow your nose, every time you yawn, every time you open your mouth and speak. You won't be able to hear because this eardrum won't move, but it'll also be either pulled in or pushed out. And again, the eardrum doesn't like to be picked on by these 3 things, but also by force. If there's cerumen blocking or wax blocking, and it's blocking enough to push against this eardrum, you'll still feel a constant mild amount of push. And this thing, even if you vary it by 1/2 of a millimeter, as far as movement, it'll still cause pain, especially if it's pushing against this organ. The other thing that sometimes happens, and you'll see it in my other video, I'll put down below, vertigo or dizziness, when there's not enough movement here and a lot of irritation, you'll also have the balance organ not work properly. That's usually because there's more fluid in this side, and as irritation occurs, you'll have inflammation. With inflammation, and usually eustachian tube getting blocked up here, fluid will accumulate, and then you'll not only will you not hear, you'll also have those 2 organs, the cochlea and the semicirculars, function improperly because there's fluid in those pipes. And when there's fluid in the pipes, and then there's actually fluid in here, and it's acidic because of its infection, it's probably infected, then there's a change in the way the fluid works. And then if the fluid changes, then the tubes don't work. If the tubes don't work, you don't hear right. And if you don't hear right, you also might not have balance. So that's it in a nutshell about what happens with regards to earwax. It's not a bad thing, and you shouldn't. I have a lot of guys that say, "I'm sorry, I didn't clean my ears out," when I check their ears, and it's not a wellness exam, or checking the ears and checking the nose, for that matter, is not to scold anybody. It's to just figure out if there's something that I should be doing. You hardly will find anybody with problem that they didn't know about already as far as an ear infection. Kids, we always check the ears because you look for redness, but in all truth, the majority of red ears can be fixed if you allow proper drainage, if you allow staying away from dairy products, is my opinion, and if you allow the body's immune system work its magic. There are some challenges with little kids, so sometimes if we need to turn around the immune system fast, we'll hit with antibiotics. And whenever there's an infection here, I really think the body's just got such a great immune system, it should be able to work, but usually we don't have enough patience and time to wait for that to work. Just so we want, most patients will they'll ask for antibiotics. And it's okay if we blast with antibiotics, that still doesn't cure everything. It'll take care of the majority of bacteria, and hopefully your immune system will take over after that. But if you continue to smoke, if you continue to have a stuffy nose, if you continue to practice bad eating habits, like I said, not necessarily, you don't have to be vegetarian, you don't have to be keto, paleo, but I don't want you to be bad food ingesting. So it always leads to other problems down the road. So if you don't take care of yourself in those ways, then antibiotics aren't really going to help you. You just need antibiotic after antibiotic, which is not a good thing for the gut either. So hopefully this does give you a little bit of idea, Deb, as far as what to do. And if there's, and if you had, there's also ear candling that I have seen from my Mexican patients. Ear candling essentially is when you take a candle, it's a coned piece of paper, it's wrapped piece of paper, looks like a cone, and you burn the cone, it has a little bit of wax in it. You burn the cone down, and usually I would assume it creates a vacuum and it pulls wax out. A lot of people say they get soothing comfort from that practice. And if you unwrap the candle, you'll see a waxy component, but I'm not sure if that's the wax getting sucked out because of the cone catching on fire and pulling through convection, air and solid out. I don't know. Or if it's just the wax that's melting from the cone falling into the bottom. I'm not sure. But if it soothes the patient and if there's no more wax afterward, then it worked. So old-fashioned versus new, it totally is up to you. But bottom line is that we want the ears to hear well. We don't want accumulation of wax. And that's the way we fix things. So if you guys have any ways that you like to do this, or if you found successful, please put them in the comments down below. Otherwise, I appreciate you giving a thumbs up and sharing this in case you know anybody that wants to or has questions about earwax. Otherwise, Deb, I will see you in the next clinic.